my role here is an assistant professor. My primary appointment is in the School of Information, and I'm also appointed in Health Management and Policy at the School of Public Health. My area of research is health informatics. I look at challenges and opportunities really around a set of technologies that, on the face of them, they don't cure diseases, they don't directly impact health or health outcomes in a way that a lot of other things do, but they're sort of a fundamental component of what's needed. What I've been very interested in is sort of how government and how policy efforts can promote adoption and effective use of information technology, and also how can organizations structure what they do in a way to make effective use of technology. What led me to choose my particular area of research was the fact that there was such widespread agreement that IT could really be this transformative tool, but also the sense that there were going to be so many challenges to doing it well. I want to study it in a way where we don't just pretend like the technology is a magic bullet, but we sort of understand how the technology is used in practice, and again, where things go well and where we need to spend more time and energy. I see the impact of my research, I think, most directly in some of the policies that are getting made around adoption and effective use of health information technology. But I think one of the benefits from being part of the IHPI community is that people are sort of taking those ideas and saying, oh, well, they could also be helpful in these other realms. And so I think increasingly it will be the sort of core of what I do, but then there'll be ways in which I think my research will be able to have a broader impact because it will sort of become pieces of other projects and researchers that are looking at other questions that are not directly about information technology, but sort of have a component that's relevant to that. I think the most important issue facing healthcare today is really how to change. I think there are so many areas in which we need innovation. We need, everyone talks about a learning healthcare system. We need to be able to, to learn and adopt innovations more quickly. But all of that fundamentally comes down to, I think, learning how to change. I think if we can really figure out how to, how to get people at all levels, right, administrators, frontline clinicians, teams to rapidly change, that would fundamentally, improve our ability to see performance gains at a much more rapid rate than we have. IHPI is serving a lot of different audiences. In some ways, its most important function is to not just be one thing. And when I think about, when I've come to the member forums or other events like that, I end up, seeing people, oh yeah, someone's mentioned to me your name before. And so, it's having that face-to-face opportunity to talk to them about, the research and think about research ideas that, we could have and work on in common together. So I feel like mostly it's just really expanded my network of potential colleagues and collaborators by making those connections that I, may not have, ordinarily sought out. I think that there's just going to be increased focus and attention on, where are we seeing these pockets of progress, and then how can we learn from and spread those. IHPI is going to play a direct role in making that a reality because part of what we do as researchers is identify those innovations and do the research to convince ourselves that there really is something there, that there really has been, meaningful progress made. So I think the first role that we're going to play is just helping the healthcare system figure out where to look for innovations and improvements. And then I think that there's, a whole different role to play in terms of, how do we get those innovations implemented on a more widespread basis. And so I think it's really going to be the combination of those two things, people who are doing the research on the innovations and people who can think about how do we spread the innovations and coming together within the IHPI framework to really drive change.